superhero.
Well, there's generally two or three major causes. Starting at the nose, there may be nasal obstructions, enlarged turbinate bones, enlarged tissue in the nose. There may be enlarged immune tissue, such as the tonsils and adenoids. Now, a lot of people don't understand what adenoids are. They're part of the immune system, and they're lining the aspect behind the nose. So here you have the nose, nasal passages in around here. So they're kind of the body's first line of defense for anything that's coming in from outside. And this is a fairly normal situation because you can see there's lots of room for air to flow down through to the lungs. But if these guys get themselves really enlarged, then you're going to have troubles breathing through the nose, and so you automatically respond by opening your mouth and trying to get in air that way. And the other aspect of it, and why we get involved as orthodontists, is kids may have small jaws. And that, when you have a small jaw, there's no room for the tongue, and the tongue provides an obstruction as well because it's got to go somewhere, and generally it falls back during sleep, and that'll cause the obstruction as well. A lot of this information is relatively new. It's only really started to come to light in the last several years, where people have started to recognize that these problems really are serious in children. And they may have gone to the point of referring them to ear, nose, and throat specialists to try and deal with enlarged tonsils and adenoids. And the research has shown some positive effects, but actually the most positive effects have been in kids who've had the obstruction removed, but also had things like expanders done for their jaws to improve the room for the tongue.